I appreciate you so much. I know your time is very valuable. What can you tell us about hormones and sleep?
Well, first of all, I just want to say thank you so much for wanting to share a platform with me. I absolutely have loved being friends and colleagues, and I love that, I'll do a shout out to Valley Sleep Center because I love that over the years, I think it's probably been more than 10, 12 years probably that I've been able to send my patients for sleep. And I love that it's a safe environment, and the specialists that you have been wonderful. So it's exciting now to be able to be doing this again and teaming up on even more fronts. And so I did, when we started to talk, I thought hormones, we've been talking about it personally and how they can affect us. And I thought, well, why not share how hormones and sleep integrate? Because it seems so real that I'm talking about this with so many patients on a daily basis right now.
So this is what I thought we would do. So everyone in the webinar, we have quite a few actually, 13. A lot of you are on Facebook Live. Go ahead and use the question and answer or the chat and just shoot a question at us. I'll monitor that. We're just going to talk back and forth. Dr. Rodarte is going to spend about 20 minutes with us, and then we're going to answer those questions. Facebook, if you guys have questions too, just fire away. So go ahead. Dr. Rodarte, tell us kind of what happens like as we're starting to feel tired or we're not tired, and how the hormones affect all that.
Yeah, so hormones are an integral part of our life. So a lot of times we don't start talking about them until perimenopause or menopause. And we need to start talking about it beforehand. Unfortunately, we're seeing changes in hormones that happen in our 30s and in our 40s before we even think of perimenopause or menopause. And it actually can affect men too. So I love that I'm looking kind of at the attendees. We've got men, we have women on there, and women need testosterone too. So it's really important that we start to have that conversation early on when we're thinking hormones can be off, because they are really incredible chemical messengers that help our body know what is happening. So our hormones can affect our mood, it can affect our sleep, can affect growth, can affect, so many different metabolic processes that are happening, not just reproduction, because sometimes people just think hormones, reproduction, don't worry about it if you're not wanting to get pregnant or stay pregnant, but it's more than that.
What about testosterone? Like you said, it's important for men and for women. And by the way, if you have Facebook and you want to share a watch party, like go ahead and click watch party, because people need to hear this stuff. Okay. So I'm going to get right down to the nugget. Okay. I'm putting you on the spot. We see so many men in our sleep center who have sexual dysfunction. So can you talk to me about the testosterone? And, I know a lot of sexual dysfunction comes from sleep apnea, but can you talk a little bit about what you're seeing and, your practice? I know you check my hormones, like you're looking at all your patients. So share with us about that.
Yeah, so one of the things I will talk about, so we talked about that I'm also board certified in obesity medicine. Well, they come to me and they're overweight, they're obese, and I worry about their testosterone level. We know that the more overweight you are, the more likely you are to have a low testosterone. Well, the more overweight you are, the more likely you'll have sleep apnea. And some people don't think that it goes hand in hand, and it really does. And so we want to talk, and I will say most men, when something's not working very well in the bedroom, that's when they'll finally start talking about it. And so I can start having that frank conversation with them, and we can talk about, do you have low testosterone? And we do some blood work about it. And then we talk about all of the options on how we can treat it if they do have low testosterone. And we also want to talk about the types of therapy and the monitoring, because it does make a difference. And we also want to treat anything else that might be coinciding with their low testosterone, right? Their diet, their sleep, their exercise, their mood, There's so many things that can affect their levels.
So what kinds of symptoms would like a male have with low testosterone? And then would you refer to a female?
So for a male, low testosterone, and they kind of go hand in hand. Both men and women can have brain fog. They can have low libido. Men most of the time will start having belly fat, where they were just like, I used to go to the gym and it would fall off of me really quickly, and it's not doing that now. They have more mood issues, where they used to get a little bit, they're getting more irritated. Women can do that too. With us, it's a little bit more the estrogen, the progesterone, and everything else. But with testosterone, I would say really big is libido, brain fog, metabolism, like putting on, some of that central obesity in there. So, and of course, the erectile issues. That's really big with men. When I talk about libido, we usually talk about, that drive, the sexual drive. But having, some erectile dysfunction, and not having their morning, how detailed are we going to be getting here? You get the drift, right? I don't know who's watching on Facebook too, but testosterone is super important there. Men start noticing that. Women, I think nowadays are going, I didn't know that was low testosterone. I always thought that I didn't need any of it. And I wanted to say, just throw this out there. A lot of times when I talk about women and replacing their testosterone, they're worried that they're going to bulk up and become really, muscular. That's not going to happen if you're doing it bioidentical and you're just replacing what you're low in, so that your body starts to function. We as women, we need testosterone too. It's not just men who need testosterone.
So as a woman, what kind of symptoms would I have if I had low testosterone?
So that's going to be, again, low libido, probably some mood changes. Women can sometimes feel achy, like their joints, not as much men, but women, like little achy joints, and soreness when they're getting out of bed. But the biggest thing is the libido, I would say, with women, and brain fog. Testosterone actually helps our brains.
What about estrogen? Should we skip to that now? I mean, unless you want to talk more about testosterone, because I know as a woman, and is there an estrogen factor for men? Like, can we talk a little bit about that and what you look for in that with sleep?
Yeah, so with men though, testosterone is important, like we were talking about, but the conversion factor. So a lot of times men will start having some of the side effects if they're doing injections or oral, different than if they're doing pellet therapy. And we can talk about the different types of therapies later, but we might use something like called DIM, and we use it in men and women to help with how they metabolize their testosterone so that they don't have an estrogen type effect. And so the balance is really important. Women need more more estrogen than men, and they'll start noticing when their estrogen is going down with vaginal dryness. So they'll have mood disturbances, sleep disturbances also. And think about women, we go through like menarche, then we kind of have our childbearing ages, we have premenopause, we have menopause, and our sleep changes throughout all of that. And if we're lucky, kind of like me, where I have a husband that, actually was really good at helping me take care of kids, still does, they actually have some of those sleep-wake cycle disturbances. And so how their hormone levels are will affect how their sleep is. And it's a cycle. So if you have poor sleep, your hormones don't work as well. If your hormones don't work as well, your sleep kind of can be disrupted. So there's a balance that we need, and we need excellent sleep. We need REM sleep in order for those hormones in the brain, and we call it kind of the pituitary axis, with all of that to connect, because, well, you've learned it from me. You're not just one part, right? We're all connected. We've got to treat the whole body.
Right. So it's like our metabolism is restored while we're sleeping. It's like you plugged your phone in, but it didn't get plugged in all the way, and you wake up and you're like, oh, that's not going to get me till noon. Like, that's what we do to our bodies when we have unrestored sleep. Like, sleep is our battery charger for our entire body and every little function that it has, right? And metabolism and pituitary and all these places that, you know, the important things to keep us running are happening at night while we're sleeping. So, you know, when we first came up with this title, I talked about timing, right? TikTok and the timing. So talk a little bit about because I remember before I got breast cancer, unfortunately, I can't have hormones now because my body creates cancer with them. What a bummer. I miss them so much. I slept so good when I would get I take my estrogen in the morning, I do my progesterone at night, and I was sleeping like a baby, literally. And then unfortunately, women with breast cancer, if they have estrogen positive breast cancer, we can't take hormones. So I'm working through that stuff with you. Thank you so much, Dr. Rodarte. So tell us about the timing and how hormones are given, and, you know, because I used to do a pill and then put cream on at night because it was important that it was at night. So can you talk about, you know, oh, and I mentioned progesterone too. So talk about that one as well.
Yeah, progesterone is really big on sleep, really, really big. A lot of times just putting progesterone back on for my women patients, they sleep like babies. It's wonderful. So yes, timing of the hormones can make a difference, but just think about all of us are a little bit different. So most of the time we'll do progesterone at night, we'll do estrogen in the morning. Testosterone, I've played around with a little bit for morning and night, depending on their sleep-wake cycle, because a great analogy is think of Benadryl. Some people are knocked out, right? You take it, you're knocked out. Other people take it and they are wired. So our metabolisms are different on how we can metabolize these medications or drugs or bioidentical. So the timing can, we kind of have a pattern where we do maybe estrogen in the morning, progesterone at night. Testosterone can kind of be either, but I always say you're a number of one. Whoever is sitting in front of me, we're going to figure out the best timing. And I will say, yes, we're doing this live. Not everybody who has gone through cancer is forever not able to do hormones, but you have to team up. You have to talk to your oncologist. The number of years out you are, it makes all the difference, the type of cancer you have. But I feel bad for women who don't think that there's anything else out there once they've had cancer. Same with our testosterone patient, our men. If you've had prostate cancer, depending on how many years out you are and how you're treated, I've worked with urologists that know that you need testosterone again, and you need that to function. So we work closely. We watch PSA levels. We watch so many different levels. And so just because you're a cancer survivor, don't ever think that you can't have hormones again. It's a discussion. The type of hormone makes a difference. So like Lori, as you were talking about, creams and pills, the biggest thing why I love that I became certified in pellet therapy is because they're more bioidentical. There are less side effects. I'm not worrying about them having to go through the liver or them being on your skin. And now you're having to be around grandkids or kids or even your wife if you're a man getting testosterone and you want to do the gel. So I want you to get with your provider and talk about all of the options so you can make an educated decision on what type of therapy you want to proceed with.
So there's still hope for me. 5 years out, we're going to talk her into it, right? Anyway, all right. So pellet. So timing, is it, I don't know much about pellets. So is it just like we come to your office? Can you explain a little bit about how that works? And then how is it released? Like, what is that all about?
Yeah, so pellet therapy is great. The brand that I use are from Yams, so it's really wonderful. There's a little bit of steroid in there. I actually use the brand called Avexapel. They're based out of Texas. What I love about them is I can physically call, the compounding pharmacy, work with them closely with my patients. My patient advocate is incredible. And there are less side effects with having a tiny bit of steroid with it. So a pellet is it looks like a pellet. It looks like a grain of rice, of white rice is what it looks like. And sometimes it looks like, like a little dot, like estrogen comes in little dots. And so you can actually they go subcutaneous, means kind of right underneath the skin, and they go either in your flank or kind of almost where your sciatic nerve kind of comes up. If you think if someone's kind of punching you in the tush, we make a little tiny incision and we put them right under there. And for women, they're great for 3 to 4 months. And for men, they can be great for up to 6 months. And it's slowly released. It's more natural. You don't have the ups and downs that can happen with oral or creams or topicals. And some people actually feel better on it because it feels like it's more natural type. So that's kind of a pellet therapy, what it's like.
So here's a question. Before I was diagnosed with central sleep apnea and started ASV, which is a ventilator type treatment that we use for central sleep apnea, I was trying to get relief from the natural testosterone supplement at Costco, DIM, KSM 66, ashwagandha, and cordyceps. But I found it mostly ineffective. Should I try starting again as I start ASV? So basically it sounds like the ASV. So do you think being like treating the sleep apnea and then they take the natural supplements, would they see any different?
Yeah, so I think that's great that they're getting the sleep apnea taken care of for sure, because their metabolism is going to start working again. Their body's going to start repairing at night. So they might need more or less hormones depending on where their body is. So that's someone who, one, is going to have a much better outcome because they're treating their sleep apnea. So that's incredible because their adrenal glands, think of your adrenal glands. A lot of people forget about them. Our cortisol is controlled by our sleep. It's one of the stress happens, you go to sleep, you need those levels to come down. If you're not, and that's then going to affect your hormones. So again, we're all connected. So if they are finally treating their sleep apnea, I think that they're going to have much better results with even starting with DIM is great. A lot of people don't understand how wonderful DIM can be.
You know, speaking of the cortisol level and it not going to like normal levels at night, what a lot of people don't understand is if you have untreated sleep apnea or periodic limb movement disorder, like any sleep disorder at night that has interruptions in your brain, it is basically like you're running a race all night long. Like you're running scared for your life all night and you don't even know it, but we see this on a sleep study. So it's so important that you do treat this stuff and then she can help you get on your way with the hormone stuff. So here's another one. Is it not true that if you get the wrong dose of pellets, you're just stuck?
Unfortunately, you can't really take them out. Within the first 24, 48 hours, we can attempt in this place that it was placed, to find the pellet and remove. But it's a 3 to 4 months for women and up to 6 months for men. And that's why it's really important that you work with someone to find the correct dose. I know for me as a practitioner, I a lot of times will underdose to make sure, because I'm also working with my patients on all other levels of their health journey. And so they usually have great responses. And so I don't overdose. And so or shoot higher than what I'm thinking when I'm doing their calculations. So I think it's really important that you work with a provider that feels comfortable and will know whether or not, if you were to have this side effect, how are we going to treat it? My first, pharmacy class was never do harm, right? First, do no harm. Second, there's no such thing as a free lunch. So you always have to have plan B, C, D, E, F. I mean, you keep going so that you know what to do if you're starting to treat someone. So that's really important. It's a great question too.
Yes, great question. So here's one. Hello, thank you for this webinar. I was getting the bioidentical pellets and I love them, but after 3 injections, my hip started aching, and I'm not sure if this was an isolated situation. Dr. Rodarte, have you ever heard where the pellets could cause pains in the legs or hips?
No, I have not. I can honestly say. I'd probably work with your provider to figure out what else is going on. I'd say more people have less achiness by treating them with their hormones and then getting working on everything else. The other thing that could be happening though is they're starting to feel well, they're starting to do more. And, then I wonder about if their arthritis or their hip issues are because let's say they were riding their Peloton, now they're doing it even more and harder. So because they've got the energy, their sleep is better, right? And so now they start to focus on some of the other things that are more pronounced, like a hip issue.
All right, here's one. In regards to testosterone replacement, does it make a man infertile?
Yes, it can. So that's a great question to talk to your provider about, because depending on your age, it may or may not make a difference to you, right? So if someone is in their 20s or 30s and unfortunately they have low testosterone and need to be treated, they need to have that conversation because their testicles can shrink as well. So depending on the time, the type. So with pellets, we don't see as much of, let's say, the elevated hemoglobin. I don't know, I'm talking to you men out there. Your doctor might have put you on testosterone and said, now we have to check to see if you make too much blood, the opposite of anemia, and then you have to go donate blood. So there's less of that side effect when you're doing pellets versus injections or the topicals. So yes, you do need to monitor sperm counts if that's important to you, testicular size if that's important to you, but the type of therapy makes all the difference. So infertility is a whole different thing. I don't treat infertility. You want to see an infertility endocrinologist and specialist for that and be monitored. And they'll probably talk about sleep there too. So I'm going to throw this in there right now because obesity is one of my passions here. If you're wanting to get pregnant, get your weight under control, because your gene is going to be turned on for whether or not that baby is going to be more likely to put on weight or not. So it goes for the man and the woman. So a lot of times we always focus on the female to make sure that she's taking care of herself, that she gets her weight down. Well, guess what? It matters, for the male as well. So you want to be healthy. You want that sperm and egg to have its best chance out there to create a baby that doesn't have to worry about obesity.
Oh, such a good input there. So does external testosterone reduce the natural testosterone production in the body?
So whenever you're using an extra form, whether it's estrogen, progesterone, testosterone, yes, you're supplementing your body. And so you're naturally going to make less. Over time though, what we hope for is you won't need as much therapy because your body is functioning better. So I know of a few patients, they've gotten, specifically like pellet therapies, and after a course of a couple rounds, they're not needing as high of doses. Their body is recovering and doing quite well.
Okay, here's one from Facebook. If you didn't do well with testosterone in a troche,
Troche,
I'm sorry, I'm like, what is this word? And got acne from it, would pellets be different?
Most likely, yes. So okay. Again, think about when the oral is having to first pass through the liver, we can have a little bit more side effects. So for women, for sure, there's less acne when you do pellet therapy. Great question.
Yeah, really good. All right, what other questions do you guys have? We have just a few more minutes. This has been so great. So if I'm having irritability as I'm falling asleep, I'm waking up at night a lot, could it be my hormones?
Yeah.
Probably, right? So I would suggest that they come to you first, because I know that you will make sure that they get to me. So Dr. Rodarte, how do we make an appointment with you? And I will ask anybody right now if they would like Activated Health to call them. I do want to say something about Activated Health. She does not take insurance, but she will give you the forms that you need to file your insurance, but she takes HSA, right? And so is this covered? Is hormone replacement, is it all cut? Can I use my HSA if I come see you to get this done?
Yes, you can. And I just learned something new. I don't even know if she's on here right now, but I love it. Her insurance covers her to get pellet therapy. So all I had to do was write a letter for her to her insurance company, and they actually are covering her pellet therapy through me. So, so yeah, that's wonderful. So we can, all I ask my patients to do is find out. There's no harm in calling your insurance company and asking if it's covered. And if it is, ask what needs to be provided. And then I will give the forms in order to get that covered.
Isn't that great? That's fantastic. Can testosterone cause irritability?
Too much testosterone can cause irritability, yes. And that's where, you know, you want to, we talked about dosing down a little bit versus overshooting. Sometimes more is not better when we talk about hormones. So we always want to just kind of make sure we're doing it correctly.
So someone asked about HSA. It's a health savings account. It's a type of insurance that you have. You usually get a credit card, and it comes along with it. So here's some more. Are there differences in weight loss or weight gain with pellets versus traditional hormone therapy?
Most of the time,
who cares not to let them gain weight, right?
I'm not going to let them gain weight, no. But I will tell you, in the first 7 to 10 days, it's not uncommon to put a little bit of weight on, and it's edema or water weight, because the hormone balance changes and everything. And just like everything else, I'm going to ask, what are you eating? How are you sleeping? What are you drinking? So a lot of times people start to feel better and they'll pick up other things. So I ask more than one question about if they tell me, I think I'm gaining weight, and I'll usually find the answer with increase in portion size, lack of exercise, poor sleep. So most of the time, weight loss starts to happen once we get their hormones squared away, because it's a domino effect. Their sleep is better, their mood is better, their energy level is better, their brain fog is gone. So I would say more common to have weight loss than weight gain.
Okay, one last question and I'll let you go. I use a gel testosterone replacement that I had a sudden weight gain of 10 pounds in 2 weeks and could not lose the weight. Could it just be that the testosterone caused this?
So I think that goes back to my first answer, but yes, for sure, it could be the swelling that can happen, the water weight. So it's not really that you put on, you know, fat, you put on water. Your body retained water from the hormone therapy. So there's different ways of treating it. And so I would say reach out to your provider and talk to them about it, because there are ways to treating it.
Yeah, thank you. All right. We have 15 attendees. Thank you so much, everyone, for joining. Thank you for all the Facebook Live people. If you guys want to share this on Facebook, please do. It's a great talk that a lot of people need to hear. You know, these are things that your regular doctor doesn't really discuss. And that's what I love about Dr. Rodarte and Activated Health. She's going to take care of everything for you. I'm living proof that she can keep a very sick person alive. And heal her in all ways. So if you would like an appointment with Dr. Rodarte, just raise your hand. I'm the only one that's going to see it. We will have one of her staff give you a call. Again, oh, thank you so much.
I think you give me too much credit. You've allowed me to walk alongside you. So thank you.
I was looking at all the inspiration. I was like, wow, look at all these inspire words on her Activated Health site. And I'm like, that's like my primary intention, to inspire others, and here my doctor is doing the same. Yeah, I feel like it's why I'm still here, to inspire others. And you know what? Look, my doctor has inspired me the whole way and never knew it.
You inspire me every day, Lori. I love you.
Girl, you know what? Have a great evening. Everyone stay healthy. Wear your mask out there.
Please.
Wear your mask. Yes, wash your hands. Don't touch your face. All right. Have a great evening, everybody.
Thank you.